What do lymphoma blood tests show about WC? When it comes to understanding lymphoma, particularly non-Hodgkin lymphoma, blood tests play a crucial role. One of the primary tests is the complete blood count, often referred to as a CBC. This test measures various components of your blood, including the total number of white blood cells, also known as WBCs, along with red blood cells and platelets. In lymphoma, the WC count can show changes in significant ways. First, there can be an increased WC count, known as leukocytosis. This often happens because of the overproduction of abnormal lymphocytes, which are a type of white blood cell. When lymphocytes are elevated, this condition is called lymphocytosis, indicating that there are more of these cells in the blood, which may include malignant cells associated with lymphoma. On the other hand, some patients may experience a decreased WC count, which is referred to as neutropenia or leukopenia. This reduction can occur when lymphoma affects the bone marrow, impairing its ability to produce normal blood cells. A low WC count can particularly impact neutrophils, a subtype of white blood cell that is essential for fighting off bacterial infections. This situation can increase the risk of infections for patients. Another important aspect of blood tests is the WC differential. This test breaks down the percentages of different types of white blood cells, including neutrophils, lymphocytes, monocytes, eosinophils, and basophils. In lymphoma, you may see abnormal shifts in these proportions, such as elevated lymphocytes or decreased neutrophils, which can reflect the activity of the disease or its impact on the bone marrow. In addition to the CBC, other blood tests are often performed for lymphoma patients. For example, the Lactate Dehydrogenase test measures levels of an enzyme that can indicate lymphoma activity and tumor burden. Immunophenotyping and flow cytometry are specialized tests that use antibodies to identify specific markers on lymphoma cells. These tests help classify the lymphoma subtype and confirm the presence of abnormal lymphocytes in the blood. Serum immunoglobulin tests are also relevant, as they measure antibody levels that can be abnormal in lymphoma. These levels may decrease after treatment, affecting the immune system's ability to function properly. Overall, blood tests provide valuable insights into how lymphoma is affecting the body, particularly the bone marrow's ability to produce normal white blood cells. They also help identify whether abnormal lymphocytes are present in the blood. This information is crucial for diagnosis, staging, and monitoring treatment responses. Abnormal WC counts can significantly influence treatment decisions and highlight the risk of infections. It is essential for patients with lymphoma to have their blood test results interpreted by healthcare professionals. These results should be considered alongside other diagnostic procedures, such as biopsies and imaging studies, to ensure a comprehensive understanding of the disease and to guide appropriate management. Always consult with healthcare providers for personalized medical advice and treatment options.